this video, I will be working through 10 typical questions that you will encounter in the Multi-Specialty Recruitment Assessment or MSRA. I will be working through both clinical and SJT or professional dilemma questions, which have been kindly provided by Pastest, who are also sponsoring this video. So make sure you watch right to the end as I go through all the 10 questions. Hi everyone, and welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP or a GP with a portfolio career. If you don't know what a portfolio career is or what a portfolio GP is, then check out one of my earlier videos. Here on my channel, you will find loads of useful information to support you on your medical career journey. So why not subscribe? And if you like the video, then make sure you give it a thumbs up. So as I mentioned earlier, Pastest are sponsoring this video and they have kindly provided a 10% discount on a subscription for everyone that watches this video. So make sure you check the description box below the video so that you don't miss out. Now, if you haven't checked out my previous video all about the MSRA exam and how to ace it, then make sure you check that video out as well. So what are we waiting for? Let's get into the video. If you haven't used Pastest before, I'm going to give you a quick tour around the website, just so you can familiarize yourself with it should you decide to join. I use Pastest as a medical student for many of my medical school exams, and I also used it for this very exam, the MSRA exam, and I found that it was really useful. I always recommend using other resources as well. The more questions, the better, so make sure you start early. So let's start with the homepage. So when you log in, this will be your homepage. You have obviously the choices to sit mock exams. We're not going to obviously do that today. We're just going to work through 10 questions. So you can click on the question bank. I have already started questions so that I could show you. So let's just go into the question bank. Now, when you do click question bank, you will see a number of different filters. So you can decide which specialty that you want to start on, or you can just go to click all if you want to. You can also select the difficulty level based on what the users have felt about the question. So if they felt it was easy, average, or difficult, so you can select one of those. Then you can also select the type. So if you wanted single best answer or extended matching questions, or of course SJT, which we know is in the exam. And some questions will have a media, so they may have images, and you can also select those. And familiarity, you can select questions that you've never seen, or questions that you've got wrong, or just questions that you've got correctly and you wanted to go over those again. And of course, questions that you've seen before. You can go through tagged, so you can select a question that you want to look at later, and you can sort them randomly if you wanted to, or otherwise, as you can see. And of course, if you really wanted to do a time test to hone in on your skills and hone in on how well you're going to do under pressure in a certain time, then you can of course select how long you want to work for, how long you want the test to last for. Here at the search bar at the bottom, you can search for a particular question. You just have to put a hash sign before the number. I will show you at the bottom of each question, there are numbers, and you just put the hash sign in front of that. You can also search for things like cardiology or MI. And so I'm going to show you how that's going to work now when you search. So let's see. Okay, so question 1. So we have a 49-year-old man who's noted to have a shortening of the QT interval on his ECG. Now, which of the following drugs is most likely to be responsible? So select the single most appropriate drug from the list below, and it's highlighted again, select one option only. And this is where it's really important to read the question. Now, like many questions in many exams, you have to basically memorize the information. And this is one of the questions where, of course, you either know it or you don't. To be fair, actually, if you do know the class of drugs and you know what drugs are in particular classes and some of the features, then you could have a particular, you could have a guess, to be honest. But the answer here is digoxin. So let's submit that. And as you can see, when you select it, it will tell you if your answer is correct. And then you can see how many people, your peers, their peer responses, and how many of those answered correctly. So you have 41% of people, and they've marked this as actually a difficult question. If you go down, you can see here that Pastest gives you very, very detailed explanations as to why that particular answer is correct. You can have a read of that. If you want to pause the video at any time, of course, pause it and you can read a little bit more. I'm not going to go into too much detail. Like I said, the learning points here are really just learn which medications lengthen and shorten the QT interval. I would always suggest learn a few drugs in each class. And of course, learn all the ECG changes of digoxin because this is a question that comes up all the time. Like, for instance, ECG changes of hyperkalemia. So we've done our first question. I hope you got that right. Like I said, if you want to have a go answering the question, then just pause the video and then you can reveal the answer later on. Okay, so our next question. Now, this one may take you a little bit longer, but it's really an extended matching question where you have all the answers there and you just have to match them to the different scenarios. So this is an ENT question. Now, again, it's something that if you know it, it's very easy. If you don't, then you kind of have to play around with the answers here. I mean, the answer's on the page. It's just trying to work out which one it could be. Sometimes it can be confusing, but of course, read the question, maybe go through all the answers here, have a look at the scenarios, and then again, go back and decide which one you're going to select. Now, if we start with hoarseness with weight loss, like I said, you can pause the video at any time if you don't want to see the answers straight away. But this is very classical of a malignancy. And so you're thinking about hoarseness with weight loss. What malignancy do we have up here? Well, we can see there's pharyngeal neoplasia. So we're going to select that one. We're going to select D. Now, I would suggest that you learn red flags for each system. So GI red flags, cardio red flags, rest red flags. This will definitely make things easier. And actually, it's very important for clinical practice. As a GP, I often ask patients if they have any red flag symptoms, and this helps me determine very quickly if something is serious or not so serious. Do I need a 2-week wait referral, or do I need a routine referral? Do I need to send the patient to A&E? So hoarseness with weight gain, again, this is one that you kind of have to know. So again, a learning point here is make sure you know the differences between hypo and hyperthyroidism. Hoarseness with associated dysphagia. Now, dysphagia, again, is a red flag symptom. Dysphagia means difficulty or discomfort with swallowing, and this is versus odynophagia, which means painful swallowing. So in this situation, you always, again, want to consider a malignancy. So again, when you read the question, you can see that you select one option, but each option can be used once, more than once, or not at all. But don't fall into the trap of thinking, oh, I've used pharyngeal neoplasia once and it therefore can't be used again, because it definitely can. Hoarseness with dyspepsia. Again, dyspepsia means difficult digestion. So you're going to be thinking about GORD. So let's submit our answers and see if they were correct. So they were all correct. What do you know? So again, you will see here the difficulty level. And also Pastest is very good because they provide you, not all the questions, but there are a number of questions where they provide you with external links. So you can click onto this link and have a read. It takes you to patient.info, which is a very, very good website. So let's go back. Now, again, you can read a bit more about as to why the particular answer was correct. As you can see, the explanation is here. Now, like I said, at any point, you can pause the video and have a longer read. But we've got quite a few questions to get through, so I'm not going to spend too long. So let's go to hematology and oncology now. I try to pick specialties that maybe aren't focused on too much versus the typical kind of cardiorest, for instance. So we have a 75-year-old retired car mechanic who is a smoker. And he is diagnosed with lung cancer. Some 10 years ago, he was treated with surgery and adjuvant chemotherapy for bladder cancer. His brother had esophageal cancer aged 66, and another brother had prostate cancer in his 70s. His 55-year-old daughter was recently diagnosed with breast cancer. So which of the following is the most likely explanation for the cancers in your patient? So again, make sure you read the question, select the single most likely explanation from the list below, and select one option only. So this is an SBA, and this is a very good example of the definition of a single best answer. So let's go. Is it going to be A, B? Is it going to be C, D, or E? Now, have a think about this, okay? So there are a lot of things in the question that you may feel might be trying to trick you. Is the family history of cancer, is that really relevant? Is that going to help us in determining if it's a hereditary cancer? Well, I'll give you the answer here. No, I think that's very unlikely here because of the ages as well and the types of cancers. Now, is his past history of cancer relevant here as well? Is exposure to asbestos something that's important? Exposure to asbestos is more likely connected to mesothelioma. So he's got lung cancer. And what do we think about smoking? Smoking is a big factor, a big risk factor for developing lung cancer. So which one are we going to select here? So again, this question was rated difficult. I've selected all difficult questions, if I remember correctly. Again, I wanted to kind of maximize the 10 questions that I chose and you're learning. You can see external links here. So let's have a look. So exposure to tobacco smoke. This is, of course, the correct answer. The only carcinogen implicated in both cancers in this case is tobacco smoke. So let's just go back and remind ourselves it was lung cancer and before he had a bladder cancer. So smoking is responsible for 85% of lung cancers and is the biggest risk for developing bladder cancer. So again, you can pause the video, have a read of why the other answers are not correct and why tobacco smoke is the single best answer. So like I said, with asbestos, that exposure is linked with mesothelioma, not bladder cancer. Okay, so our next question. A 57-year-old man attends his general practice surgery for a routine medication review. You notice this characteristic light brown macular rash on his forearm. So they have given you a lot anyway. If they're saying characteristic and they're describing it. So this is where you need to know your dermatology terms, macular or a patch. This one is like a spot diagnosis. You kind of know it or you don't. But if you didn't know it, you could definitely eliminate some of the other ones like psoriasis, because psoriasis often looks scaly, pink, or kind of red erythematous with some scaling as well. So it's not going to be psoriasis. Hemosiderin deposition, usually on the legs, usually linked to chronic venous disease. And the last two, this might look more like an urticarial rash, and then a phototoxic reaction may be seen as like blisters. It's a cafe au lait patches, and the explanation is given to us here. So there's a very long explanation, which is really good, and this is pretty much all you need, I think. I will link to a really useful dermatology website in the description box below the video. Okay, so again, you can pause the video and you can have a read of the answers. And like I didn't show you before, but like I was talking about before, that's the number that you want to search if you ever want to go back to the question, or you can tag the question as well. A 5-year-old girl is brought to her general practitioner by her mother with a 3-day history of fever up to 37.8 degrees Celsius. She's had no history of lesions on the buccal mucosa, but developed a macular papular rash across the face and trunk. A few days before the appearance of the rash, she complained of some eye pain, sore throat, and general body aches. On physical examination, she has a discrete rose pink maculopapular rash on the face, neck, and trunk, a low-grade fever, and enlarged posterior auricular and suboccipital lymph nodes. So there's a lot in that question. And again, they are hinting very heavily here to rubella. So again, it's not going to be meningitis. It's not going to be mumps. Again, they have classical features as well as the scarlet fever. So the learning point here is to make sure you know your childhood rashes, you know your childhood diseases, and also the vaccination program as well for children. So and also make sure you know the alternative name for rubella. So German measles is also known as rubella. It's a difficult question according to what other users have thought about it. Again, you can pause the video at this point if you want to have a read in a bit more detail. But as you can see, there's a lot of information about rubella for you to read. And again, it talks through why it's not meningitis, mumps, scarlet fever, or erythema infectiosum. Now we get into the professional dilemmas. Some of you may be struggling with them, but a point here is that you can't really do too badly in the sense that you're not going to be marked 0. You will always get some points for some of the questions or some of the order you've placed or you've ranked the responses in. So let's get into the question. You are a foundational F2 doctor working the evening on-call shift. You have been asked to cover the neurology wards. You receive an urgent bleep from one of the ward nurses telling you one of the patients is convulsing. You have never worked in neurology before and are unsure what to do. So again, there's a few learning points here. So the learning points here is to know your limitations. And of course, patient safety is of utmost importance. This is our first concern, our primary concern. So you have to read through all the responses, and you have to rank in terms of what is the most appropriate versus what is the least appropriate. So, number 1, I think what you should do here is recognize that you have not worked in neurology before and that you have no idea what to do or not a very good idea in terms of what exactly the steps you should take are. But the first thing you should do is call for help. Request that another more senior doctor is bleeped immediately. So tell the staff, be honest with them, and then really a registrar, someone senior than yourself, should go and assess the patient. They would have had much more experience than yourself. Now, the other thing you could do, which would be the second most appropriate thing to do, would be obtain as much information as possible regarding the situation and attempt to stabilize the patient. But of course, it's not going to be number 1 because, like you said, you don't know what you're going to be doing. But of course, you'd be able to maybe stabilize the patient working through your doctor A, B, C, D, E. Number 3 would be use it as a learning opportunity, of course. Going down the ranks now will be to complete an incident form, a clinical incident form. And then lastly would be, of course, the most inappropriate thing to do or least appropriate thing to do would be to immediately try to address the issue without seeking further help. As you feel it will be a sign of weakness, that is something that you should never, ever, ever do. So I'm not going to rank it all. I'm going to submit it. And it tells you here what you should do in the order that you should do it. So 1, 2, 3, 4, and 5. And it has very, very good explanations as to the order. Again, there are some external links to the GMC, which again, you should be familiar with in terms of good medical practice. Now, this was a very difficult question. Like I said, I selected very difficult questions for you. So don't be too hard on yourself if you're struggling, because they are very, very hard questions. Okay, so you are a Foundation F2 doctor. You have type 1 diabetes. You are in the middle of a busy, long day on-call shift when you realize you forgot to bring your insulin with you, which you will need for your afternoon meal. So rank in order the following actions in response to this situation, 1 being the most appropriate and 5 being the least appropriate. So again, the general learning points here would be, number 1, protect your patients by looking after yourself and recognizing when you do need help and when you're not able to work or to carry on or to work safely. You should not treat yourself or treat those close to you like family and friends or friends of friends. And of course, ward medications are for patients only. So you might feel that the most appropriate thing to do would be to call one of your housemates, and that's not wrong. I think that would be the most appropriate thing here to do, because your housemate may be able to make some time in their day to bring you your medication, and that obviously saves you having to go to A&E. But that would be the next best step then, to go into A&E so that you can have some insulin there. So I'm not going to rank all of these, but of course you can pause the video and work it out for yourself and make a note of what you would have done. And then now let's get to the answers. So 1 would, of course, be to call your housemates. 2, book yourself into A&E. 3 would, yes, to call your GP and see if they can get your medication to you, but that may take a little bit longer, admittedly. 4 would be to write a self-prescription, because this is obviously not the most, this is obviously going towards more least appropriate. And then 5 is taking medications from the ward, from the patient. So that, again, that is the worst option, basically. And again, there's a very detailed explanation about what you should do and how you should rank the question. So this is another type of question. This is where you select 3 options. So you are Foundation 2, F2 doctor working in the emergency department. You have reached the end of your shift, and before leaving, you remind one of the nurses that a patient who has just been admitted with chest pain needs to have blood taken within the hour. The nurse tells you, hold on a minute, the department has just got very busy, and so that patient will have to wait. They are quite abrupt in their response to you. So what are the 3 most appropriate things that you should do? So I will scroll down for you to have a couple of moments to decide on which ones you're going to pick. I think this type of question is probably a little bit easier, because the things that you wouldn't do are very obvious, I would say. But sometimes in the other questions, yes, it's very obvious, but then you have a few options here. And so you're bound to get a few of those correctly, if not all. And I personally found these questions were much easier for you to score 100% on. So have a read, and you can pause the video if you like, but let's get into the answers so we can talk about the learning points. So B, ask your F2 colleague who's taken over from you to take the patient's blood. Now, of course, you finish your shift, you're probably going to be tired. Someone's coming on. There's a whole point of having a handover with the doctor so that they're fresh, they can come on, they can take the blood for the patient. Again, C would be discuss the procedure for taking a central blood test at busy times with the department, but at a later time. Keyword being at a later time. This is not appropriate to do it now. And privately speak to the nurse in question. Maybe just approach her and say you weren't comfortable or weren't happy about the way that she spoke to you. General learning points would be communication, teamwork with your nurse, with your colleague who is coming on after you, patient safety, of course, and effective handover. I have a previous video where I talk about working and starting work as a new junior doctor, so you may want to check that video out for some useful tips. So I hope you're getting the gist of this. So let's do 2 more questions. So next question, again, it's going to be one when you select 3 of the most appropriate actions to take. You are an F2 doctor, again, working in GP this time. General practice. Your next patient is a 21-year-old patient who lives with her parents and has learning difficulties. She asks you about screening for STIs, as she's worried she may have caught something from her boyfriend because he does not keep himself clean. The boyfriend, aged 30, lives in the family home. On further questioning, you discover that the patient is unhappy in this relationship and unsure of what to do. She says her mother has offered the boyfriend to stay in the house should they split up. She also becomes distressed when you examine her and take swabs. She denies being forced to have sex. She says the relationship has been going on for 2.5 years. So you can calculate her age at the time the relationship started. So what are the 3 most appropriate actions to take? So there are a few general learning points here and things that you should be aware of. Ethical things, capacity and consent. Does this patient have capacity? Is this patient at risk of being abused? Is she being abused? And how do you go about seeking support or seeking advice about this particular patient? Also, empathy, sensitivity to her situation. And again, it touches on things like knowing how to take a sexual history. So again, I'm not going to select them. Like I said, you can pause the video to decide on what you're going to do. So here we go. You have to make a careful assessment of the patient's capacity for consent. You have to make sure you know the Mental Capacity Act. So if a patient doesn't have a capacity, then you have to do a number of things, and you basically have to make sure that you're acting in that patient's best interest. And there's a number of ways in which you can do this. So this is most likely a case of abuse, and you should therefore involve someone senior. So I have left a link in the description box to the Mental Capacity Act. Make sure you know that. And of course, take a sensitive full sexual history. Now, like in the previous questions, there's a very, very good explanation here. A few other things again to touch on would be know what to look out for and when to seek support regarding abuse. Now, this is not just for females, this is for men as well, and also for children, the elderly, and of course, vulnerable, as in this case. So make sure you know who to contact when you're working in a GP surgery or in the hospital, or even an outside agency like social services. Now, again, just a point here, you will not be making these decisions on your own. So make sure you always involve a senior doctor, and you can do this as an MDT. You can work together to decide on what is the best course of action. So again, these are all difficult questions. So don't be hard on yourself if you feel like it's very hard and you're not getting it. You will get it. It's just about practice and just knowing key things for the exam and for clinical practice, really. So our very last question. I hope you've enjoyed it so far. You are working as a foundation F2 doctor in general practice again. You are running late due to acutely ill patients, and the final patient has been waiting for 45 minutes, which is not uncommon, I'm afraid. You have seen him several times before, and you know he is usually a very polite man, but he has been suffering from work stress and depression. He arrives into the consultation room very distressed, tearful, and angry about the wait. He's pacing the room and very agitated. He does not threaten you or use abusive language. So make sure when you're reading the questions, you are picking out key words. They're explaining to you that he's very upset. However, he is not being threatening to you or using abusive language. And this will determine what actions you take. And what actions that you're choosing when you go to select your answers. So like always, take a moment to pause the video if you don't want to know the answers. I'm not going to select the answers, I'm going to submit, saving some time here, and we're going to go through this quickly. So the options are, you can discuss rearranging an appointment so you can address the issues when he is calmer. He may not want that. Alternatively, then you can give him some time to wait. But this is obviously clearly one of the things that you can do. Stay calm yourself. Of course, you should apologize for his wait and ask him to take a seat, and tell you about his problem so that you can actually help him. And apologize and stay calm. And you can always offer the chance for him to see or speak to another member of staff. So these are the most appropriate things to do. I think it's quite clear the options that you shouldn't be picking. But of course, there's always an explanation if it's not clear to you. So some of the learning points here would be your ability to work under pressure and how you're able to stay calm in what can be a very stressful situation. So those are all the questions. I hope you learned loads. I hope that you will go on and pass your exam. I'm sure you will. Don't forget, if you want to excel in your exam and you want extra tips on how to ace the MSRA, then check out my earlier video. And thank you once again to Pastest for sponsoring this video. And if you liked what you saw, then make sure you visit pastest.com and you can take out a trial of the MSRA subscription completely free. And if you are getting benefit from it, then use the code below the video so you can get 10% off. As always, if you like the video, then make sure you give it a thumbs up and subscribe if you haven't already. I will see you in my next video.